Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Tonight, we're going to talk about something millions of people suffer from in silence, waking up again and again at night with that urgent pressure in the bladder, that uncomfortable, restless feeling, that interrupted sleep, that frustration. If you're constantly running to the bathroom before bed, or worse, waking up multiple times in the middle of the night, this is not just aging, and it's not something you have to live with. Your bladder is a muscle, and like any muscle in your body, it responds to the right stimulation, the right positioning, and the right neurological signals. The key is learning how to trigger the natural reflex that allows your bladder to empty completely. Tonight, I'm going to show you 3 simple bedtime exercises that can help you empty your bladder fast and more completely, naturally. Let's start with the science. Every night, millions of people sit on the edge of their beds, exhausted, frustrated, and confused because they just went to the bathroom. And yet the pressure is still there. That uncomfortable fullness, that nagging sensation that something didn't finish, and within an hour, sometimes within minutes, they're back again. What most people don't realize is this: the problem is often not the bladder itself, it's coordination. Your bladder is not a passive bag. It is a living, intelligent, muscular organ lined with stretch receptors that constantly report to your brain. When it fills, those receptors send signals through the pelvic nerves to the spinal cord and up to the brainstem. When your brain decides it's safe to urinate, it sends a powerful command back down, telling the detrusor muscle, the smooth muscle wall of the bladder, to contract. But at the exact same moment, another critical command must happen. The pelvic floor muscles must relax. If they don't, you are literally pressing the gas pedal and the brake at the same time. Research in urology has shown that incomplete bladder emptying, what doctors call elevated post-void residual volume, dramatically increases urinary frequency and nighttime awakenings. Even as little as 50 to 100 milliliters of retained urine can create persistent urgency signals. That's less than half a cup standing between you and uninterrupted sleep. And here's the shocking part. Many people who think they have a weak bladder actually have an overactive, tight pelvic floor. Chronic stress, prolonged sitting, abdominal gripping, even excessive Kegel exercises can keep those muscles locked in a subtle state of tension. When muscles are tight, they don't function better. They function worse. Studies using pelvic floor electromyography have demonstrated that hypertonic pelvic muscles interfere with normal urinary flow and prolong voiding time. In simple terms, if those muscles don't let go, the bladder cannot empty fully. Think about what that means. You finish urinating, you stand up, but inside, a small amount of urine remains trapped because the pathway wasn't fully open. That leftover fluid continues stretching the bladder walls, triggering stretch receptors that scream to your brain, "You're not done." So you go back again and again. Now imagine this instead. You sit down and give your body permission to coordinate. You lean forward slightly, bringing your elbows to your knees. This is not random advice. Clinical observations have shown that posture directly affects urinary flow rate. Leaning forward changes the angle between the bladder and urethra, reducing obstruction and allowing gravity to assist. In elderly populations, forward lean positioning has been associated with improved bladder emptying efficiency. Sometimes the difference is measurable in seconds. Then you breathe, not shallow chest breathing, deep diaphragmatic breathing. When you inhale deeply, your diaphragm descends, your abdominal cavity expands, and gentle pressure builds around the bladder. When you exhale slowly, that pressure shifts downward in a controlled way. Studies in pelvic health physical therapy show that diaphragmatic breathing reduces pelvic floor muscle overactivity and improves relaxation response. You are not forcing urine out. You are restoring the natural reflex arc between brain and bladder. And here is where it becomes powerful. After the first stream stops, you don't rush away. You wait 20 seconds, 30 seconds. During that pause, neural signals recalibrate. The detrusor muscle can generate a secondary contraction once the outlet is fully relaxed. This is known clinically as the double void technique, and it has been recommended in urology literature for reducing residual urine in both men and women. That second stream you notice, that is urine that would have remained trapped. The consequences of leaving urine behind are not minor. Persistent residual urine increases the risk of urinary tract infections because bacteria thrive in stagnant fluid. It increases bladder wall irritation, which heightens urgency. Over time, chronic incomplete emptying can even weaken bladder contractility due to overstretching. The cycle feeds itself. Tension leads to retention. Retention leads to urgency. Urgency leads to anxiety. Anxiety leads to more pelvic tension. But when coordination improves, everything changes. The detrusor contracts fully. The pelvic floor relaxes completely. The urethra opens without resistance. The bladder empties efficiently. Stretch receptors quiet down. The nervous system shifts into parasympathetic dominance, the same rest and digest state required for deep sleep. This is not guesswork. Functional MRI studies have demonstrated that urination involves precise activation and deactivation patterns in the pontine micturition center of the brainstem. It is a finely tuned neurological symphony. When muscles fight each other, that symphony becomes noise. When they cooperate, it becomes rhythm. Consider this: adults typically produce more urine at night if sleep is fragmented. That means the more you wake up to urinate, the more your body may continue producing urine, perpetuating the cycle. But if you empty completely before bed, you reduce one of the strongest triggers for nocturnal awakenings. Research on Nocturia consistently shows that reducing post-void residual volume improves nighttime sleep continuity. Better emptying tonight can mean fewer interruptions at 2 a.m. And there is another layer many people overlook. Chronic abdominal gripping, pulling your stomach inward throughout the day, creates downward pressure on the pelvic floor. Over months and years, this alters coordination patterns. The body learns tension. Relearning relaxation may feel unfamiliar at first, even vulnerable, but muscles remember what you practice. Neural pathways strengthen with repetition. When you consciously lean forward, breathe deeply, and wait for that second release, you are retraining your nervous system. You are teaching your body that urination is not a rushed event squeezed between tasks. It is a reflex that deserves completion. Imagine sleeping through the night without that jolt of urgency. Imagine standing up from the toilet feeling genuinely empty. Imagine breaking the cycle not with medication, not with invasive procedures, but with alignment and coordination. The truth is, strength alone does not solve dysfunction. Precision does. The bladder must contract at the right time. The pelvic floor must release at the right time. The brain must permit it. When those three elements synchronize, the system works the way it was designed to. So tonight, when you make your final visit to the bathroom, slow down. Sit fully. Lean forward gently. Take a deep breath into your belly. Exhale slowly. Wait. Allow the second wave to come. Feel the difference between rushing and completing, because sometimes the problem was never weakness. It was miscommunication. And once you restore coordination, you don't just empty your bladder, you restore confidence, you reclaim your sleep, and you remind your body that it still knows exactly how to function when you give it the chance. At 2:17 in the morning, the room is silent, but your body is not. A sudden pressure, a signal that refuses to be ignored. You open your eyes, frustrated, already tired for tomorrow, and you wonder, why does this keep happening? What if I told you the real issue may not be your bladder at all, but your nervous system? Your bladder does not act alone. It is wired directly into one of the most powerful control networks in your body, the autonomic nervous system. This system has two major branches: the sympathetic, known as the fight or flight response, and the parasympathetic, known as rest and digest. Only one of these allows you to urinate properly. The parasympathetic nervous system is the master of bladder emptying. When it activates, it sends signals through the pelvic nerves to contract the detrusor muscle while simultaneously telling the urethral sphincter and pelvic floor to relax. It is a beautifully coordinated reflex. But when stress dominates, when the sympathetic system is in control, that coordination breaks down. Modern life keeps most people in a low-grade fight or flight state all day long. Emails, deadlines, financial stress, family pressures, endless scrolling. Even artificial light at night disrupts circadian rhythm and keeps stress hormones elevated. Studies show that chronic stress increases muscle tension throughout the body, including the pelvic floor. And when those muscles remain tense, the bladder cannot empty efficiently. Here's the shocking truth. Clinical research has demonstrated that individuals with overactive bladder symptoms often show signs of autonomic imbalance, meaning their sympathetic nervous system is overactive and their parasympathetic tone is reduced. In other words, their bodies are stuck in survival mode, even when they are trying to sleep. When you attempt to urinate in that state, it's like trying to relax your fist while someone is shouting at you to run. The brain is not signaling safety, and urination requires safety. The pontine micturition center in the brainstem only initiates full voiding when it perceives that you are secure enough to release. This is evolutionary biology. You would not want to empty your bladder while escaping danger. But your nervous system doesn't know the difference between a charging predator and a stressful day at work. It responds the same way: tight muscles, elevated heart rate, heightened alertness, reduced parasympathetic activation. So, how do we shift the balance? One of the most powerful tools is diaphragmatic breathing, not casual breathing. Intentional, slow, deep breathing that engages the diaphragm fully. When you inhale deeply through the nose and allow the belly to expand, the diaphragm descends, stimulating the vagus nerve, the longest cranial nerve in the body and a primary driver of parasympathetic activity. Research published in physiological journals has shown that slow diaphragmatic breathing increases vagal tone, lowers heart rate, reduces cortisol levels, and enhances parasympathetic dominance. In simple terms, it tells your body you are safe. And when the body feels safe, the bladder listens. Pelvic health specialists have documented that diaphragmatic breathing decreases pelvic floor hypertonicity. Electromyography readings reveal reduced muscle firing in the pelvic floor during slow, controlled breathing exercises. That means tension melts away not through force, but through neurological reset. Imagine lying on your back before bed. The lights are dim. One hand rests on your lower abdomen. You inhale slowly for 4 seconds, feeling your belly rise. You imagine the pelvic floor softening downward like a hammock gently releasing. You exhale for 6 seconds, longer than the inhale, activating deeper vagal pathways. With each breath, your heart rate slows, blood pressure drops, muscles unwind. This is not meditation fluff. This is neurophysiology. When parasympathetic tone increases, detrusor muscle contraction becomes more coordinated. Urethral resistance decreases. Residual urine volume declines. Clinical programs that incorporate relaxation training and breathing techniques have reported measurable improvements in urinary urgency and frequency within weeks. Now consider another fascinating connection: the tibial nerve. This nerve originates from the same sacral spinal roots that control bladder function. In hospitals and urology clinics, a therapy called posterior tibial nerve stimulation is used to treat overactive bladder. A small electrode near the ankle delivers rhythmic pulses to modulate bladder reflex pathways. Studies have shown significant reductions in urinary frequency and nighttime awakenings using this method. But you don't always need electrodes. When you perform slow, controlled heel raises, lifting onto your toes and lowering with awareness, you stimulate mechanoreceptors that send signals through the tibial nerve pathway. While it's not identical to clinical stimulation, it engages overlapping neural circuits. Gentle, repetitive activation can help regulate sacral nerve activity and improve bladder signaling coordination. This is the power of neuromodulation. Not suppression, not medication, regulation. Think about the implications. Instead of silencing your bladder with drugs that may cause dry mouth, constipation, or cognitive side effects, you are retraining the wiring. You are restoring balance between sympathetic overdrive and parasympathetic restoration. And here's another compelling fact. Sleep itself strengthens parasympathetic tone, but fragmented sleep weakens it. So when you wake repeatedly to urinate, you reduce the very nervous system activity needed to fix the problem. It becomes a vicious cycle. Stress increases urgency. Urgency disrupts sleep. Disrupted sleep increases stress. Breaking that cycle starts before you lie down. 10 minutes of diaphragmatic breathing before your final bathroom visit. 10 controlled heel raises to stimulate sacral pathways. Then a slow, unrushed void using forward lean posture. This sequence sends a powerful message through your nervous system. Calm, coordinate, complete. Within days, many people notice subtle changes. The stream feels smoother. The sensation of fullness fades more completely. Nighttime awakenings decrease, not because the bladder magically shrank, but because the brain and bladder began communicating properly again. Neuroscience tells us that neural pathways strengthen with repetition. The more often you practice parasympathetic activation before urination, the more automatic it becomes. The brainstem circuits adapt. The pelvic muscles respond faster. The reflex regains precision. This is empowerment rooted in biology. Your bladder is not your enemy. It is responding exactly as your nervous system instructs. When you calm the system, you calm the symptoms. When you regulate the nerves, you regulate the urge. So tonight, instead of dreading that late night interruption, consider this possibility. Your body is waiting for a different signal, a signal of safety, a signal of rest, a signal that says it's okay to let go completely. Slow your breath, stimulate the nerves gently, restore parasympathetic dominance, because the hidden key to emptying your bladder faster and more completely is not force, it is balance. And when balance returns, sleep follows. What if I told you that the difference between waking up 3 times a night and sleeping straight through until morning is not a surgery, not a prescription, not a miracle supplement, but a handful of small decisions made in the final hour before bed? It sounds too simple, and yet physiology proves it over and over again. The body responds to patterns, not intensity, not occasional effort. Patterns. Your bladder does not operate on willpower. It operates on rhythm. Hormones rise and fall in predictable cycles. Nerve signals strengthen with repetition. Muscles adapt to what you repeatedly ask them to do. And the final 60 to 90 minutes before sleep may be the most influential window of all. Let's begin with a shocking fact. Studies estimate that nearly 50% of adults over 50 wake at least once per night to urinate, and a significant percentage wake 2 or more times. This condition, known as nocturia, is strongly associated with sleep deprivation, increased fall risk, metabolic dysfunction, and even higher cardiovascular stress. Interrupted sleep is not just inconvenient, it changes your biology. But here's what most people never consider. The bladder you take to bed is the bladder you built all evening long. If you drink large volumes of fluid within 60 minutes of lying down, your kidneys will continue filtering at an accelerated rate while you try to sleep. Research in renal physiology shows that urine production naturally slows at night due to antidiuretic hormone, also known as vasopressin, but excessive late fluid intake can override that protective mechanism. Timing matters. That doesn't mean dehydration. It means strategy. When you gradually taper fluids 90 minutes before bed, you align with your circadian rhythm instead of fighting it. You allow vasopressin to do its job, concentrating urine and reducing nighttime output. This is not a trick, it is hormonal synchronization. Now let's talk about magnesium-rich foods. Magnesium is involved in over 300 enzymatic reactions in the body. It regulates muscle contraction and relaxation, nerve transmission, and stress response. Clinical data suggests that magnesium deficiency is more common than many realize, particularly in individuals under chronic stress. When magnesium levels are low, muscles become more prone to tension and spasms, including smooth muscle like the bladder. Imagine ending your evening meal with a small serving of pumpkin seeds, almonds, or lightly cooked spinach. Not a heavy snack, just enough to provide bioavailable magnesium. Research published in nutrition journals has linked adequate magnesium intake with improved muscle relaxation and better sleep quality. Better sleep strengthens parasympathetic tone. Stronger parasympathetic tone improves bladder coordination. Everything connects. Now picture this sequence. 1 hour before bed, you finish your final light nourishment. The lights in your home dim slightly. Screens are reduced. Cortisol begins to fall. Your nervous system prepares for restoration instead of stimulation. 10 minutes before your final bathroom visit, you lie down on your back, knees bent, one hand resting gently on your abdomen. You begin slow diaphragmatic breathing, inhaling deeply for 4 seconds, exhaling for 6. Studies on vagal nerve activation show that longer exhalations enhance parasympathetic output more effectively than equal inhale-exhale ratios. With each breath, heart rate variability improves, a measurable indicator of nervous system balance. After 10 slow breaths, your muscles feel heavier, your jaw softens, your pelvic floor begins to release subconsciously. This is not imagination. Electromyographic studies confirm reduced pelvic floor activity during deep breathing practice. You are preparing the outlet before the bladder even contracts. Then you stand, calm, unrushed. You perform 10 controlled heel raises, lifting onto your toes for 3 seconds, lowering slowly. This gentle movement stimulates the tibial nerve, which shares sacral roots with the bladder's nerve supply. Clinical posterior tibial nerve stimulation is an FDA-cleared therapy for overactive bladder, demonstrating significant reductions in urinary urgency and frequency in peer-reviewed studies. Your heel raises are a simplified, natural neuromodulation signal, a reminder to the sacral plexus, regulate, don't overreact. Then comes the final visit to the bathroom. You sit fully, you lean slightly forward, you breathe, you wait after the first stream ends, you allow the second release. Research on double voiding techniques shows meaningful reductions in post-void residual urine volume. Even small decreases in residual volume can reduce stretch receptor activation and nighttime urgency. And here is where the power of consistency reveals itself. The nervous system is plastic. That means it rewires itself according to repeated experience. When you rush through urination night after night, your brain encodes urgency as the norm. When you complete the sequence calmly and fully, your brain encodes efficiency as the norm. Within days, subtle changes appear. The stream begins more easily. The sensation of incomplete emptying fades. The time between urges lengthens. Within weeks, sleep becomes less fragmented. Studies on behavioral bladder training demonstrate that structured routines significantly reduce nocturia episodes over time, not overnight miracles, but steady neurological improvement. And consider the compounding effect. Better sleep lowers cortisol. Lower cortisol reduces nighttime urine production. Reduced nighttime awakenings enhance deep sleep stages where growth hormone supports tissue repair and nervous system recalibration. The cycle that once worked against you begins working for you. This is the beauty of small nightly habits. They do not shock the body, they guide it. They respect physiology instead of overriding it. In a world obsessed with quick fixes, the most powerful medicine may be repetition. The body trusts what you do consistently, not what you attempt once in frustration. Imagine 30 nights from now. You climb into bed without dread. You close your eyes without calculating how many times you might wake. You sleep longer, deeper. Your mornings begin with clarity instead of exhaustion, all because you chose structure over chaos in the final hour of your day. The science is clear. Hormones follow circadian rhythm. Muscles follow neural signals. Neural signals follow repetition. And repetition begins with simple decisions. When to stop drinking fluids, what minerals to nourish your body with, how to breathe, how to stimulate the nerves gently, how to empty completely. This is not about perfection. It is about consistency. Small habits performed nightly create biological momentum. Your bladder is not unpredictable. It is responsive. Your nervous system is not broken. It is adaptable. Your sleep is not lost. It is waiting for alignment. So tonight, begin the ritual. Light nourishment, fluid timing, deep breathing, heel raises, double voiding, because when small habits become consistent signals, the body transforms quietly, and the reward is something priceless, uninterrupted rest.